an interesting study came out with pot. Pot is hot these days. The Boston Medical Center and the Boston University School of Medicine have found, according to this new study, that marijuana has no negative effects on human health. That's right. Let's take a look at some of the study. They found that no differences between daily marijuana users and those using no marijuana in their use of the emergency room, hospitalizations, medical diagnoses, or their health status. Our findings suggest that the marijuana use has little measurable effect on self-reported health or healthcare utilization in adults using drugs identified in a primary care clinic. So this is obviously linking health directly to marijuana use, and they're not seeing any discrepancies. I'm going to guess that this doesn't surprise any of the three of us. Rick, I start with you.
Once again, I think they read their mail. Just like Dr. Sanjay Gupta suddenly read his mail and said, yes, dude, you want to stay on the air? You got a lot of people who are furious with you. Mm-hmm. You got to give that up. So pretend it's a giant epiphany and change in your position on air. You're up in 5, write something good and go.
Yeah.
And I think
essentially he probably knew, but
he knew a long time ago. But his pharmaceutical backers, which might mean they are coming closer to their own cannabinoid pharma version of everything that'll work this time. The one says, okay, tell Sanjay he can ease up a little bit now.
Well, that's an interesting...
Really astute, because in the quote, it kind of tells you that.
Right.
Yeah.
But that's a really interesting theory, I think, that you think that they're somehow going to figure out the pharmacological version, and then...
That's one of the boom industries that's saving California and saving Washington and saving Colorado. The economies are boosting up like crazy from it. Someone who had the previous power base is going to pay a ton of attention to that and have huge, long oak desk meetings about what they're going to do to have their piece of that.
Yeah.
Like the way cigarette companies are figuring out now what packaging will look like.
Yeah, and
they're
this
planning just the business model. That means an inevitability. When they have the new munchie meal from Burger King,
right?
Everyone's prepping and ramping for it now.
So you'll get the weed next door to Burger King, and then you'll go in for the munchie meal at Burger King. So obviously this doesn't surprise us,
no.
But what is it about everybody that takes them so long? So Sanjay Gupta is a good example, and I know your answer already, but he was one of these people that was completely against it. Then he had this huge mea culpa a couple of weeks ago. Everything I knew was wrong, but I'm not a doctor. I knew that it was okay.
I think we all have for a very long time. I think there's two factors going in here. I think you're absolutely right. I think that even in that statement that you just read, you could see that the language they're using is starting to move towards it has no impact on people seeking treatment. It has no impact on the weight of the healthcare system is what they're essentially saying. They're saying emergency rooms and people coming in for treatment are no sicker, are needing no more care, no more financing from the government or anybody. And I think they're also paving the way for it to be legal so they can get money from it. And all they need to do is flip the switch in certain people who need the authorities to tell you. So right now we have lots of older baby boomers. We have lots of conservatives. We have other people that like authoritarian, like it or not, some people like authoritarian things to be told to them before making their decisions. Some people are just more comfortable that way. They're not comfortable getting their information from the internet or common sense. They like to be told ABC equals this, So I think that once the government and once more studies funded by universities and once people like authorities like Dr. Sanjay Gupta, who's now an authority, apparently he's on CNN, great. But that's going to mean that people are more comfortable now with it. So we all knew this. I think people that are forward thinking know this, but it's just that last, there's like the early adopters and there's that last wave. They need to be told it's okay. And now
what are those guys called? We have the early adopters. That sounds good.
Right.
What are the people who you have to drag at the end?
The dumb, deaf, and blind. I don't know.
The dumb, deaf, and blind.
No offense to the blind people and deaf people that are at home going, I knew that, and come on.
Right, so just playing the devil's advocate here, as I have to do occasionally, is there any risk in this that if you make all this stuff, or if you make weed legal, that then kids will be trying it younger, and when their brains are forming and the cognitive parts of their brain, and they're putting in weed that often now is much stronger than it used to be, and all that kind of stuff? Is there a risk?
Compare it to the alcohol model? Between the 20s and now, is maybe there's a prohibition to canceling prohibition model you can look at for that, and I could check the stats on that. It's an interesting, good question. I don't know what the numbers would be for that.
Yeah,
but like everybody.
So
If you're a kid and you want to drink when you're in junior high or high school, you're probably going to have a few drinks the same way. If you were going to smoke pot, you were going to smoke pot. I think you are correct by saying it's like prohibition. I don't think saying that it's legal for medical purposes is going to entice a kid. Like, oh, for medical purposes, this is cool. It's cooler for me to smoke now. I think maybe it'll make it a little less cool that it's a kind of a medicinal thing rather than like a naughty thing or just to get messed up.
Right, and the second you can get it at the Starbucks of weed,
Yes.
it won't be cool anymore. So final thought on this.
Right.
2016, is there a chance that one of the candidates, that a real sort of mainstream candidate, is going to get on board at least legalizing it at the state level? I could see maybe somebody doing that. Is that totally
You
crazy?
have a states' rights candidate possibly who will defer to that, but will not come out in support of it.
Okay, so somebody, probably a Republican who's big on states' rights,
Right.
who will get no traction
Right.
really.
Or a Democrat could say it too, but they would just say it's not federal government's responsibility. Look, Democrats it would behoove them to do that so they could say, look, we're not trying to be big government and regulate you. Let the states decide and kind of say, look, Republicans, if that's what you like, then you just like my policy.
It'll be the candidate on the ropes.
Right.
Pull out the pot, Floyd. Boom, throw that out there. Hey, but I may have all these scandals, but look what I brought here.
I got weed for everybody.
But come on.
Let's
you
have
know
fun.
you'll vote for me.
We like that guy. We don't know who he is, but we like him. Hey guys, the Rubin Report is brought to you by Coupaw.com. They've got 75% off dog and cat chews, toys, accessories, home goods, and more. Use code RR for 20% off your next purchase. The link is right down there.